Well, very vocal and frustrated nurses here. This is, as you were saying, the first ever strike in their 160 years existence. The Royal College of Nursing has gone on strike UK-wide. That does not include Scotland, so it is actually England, Wales and Northern Ireland. And how it's going is, it's extraordinary to stand here in freezing temperatures and to see local hotels bring pizzas, coffee, all kind of hooting, as we say here, honking, I think is the American term, from buses, from lorries, from cab drivers, waves from police, people really feeling for these nurses. One of the slogans here is, clapping doesn't pay the rent, clapping doesn't pay the bills. And yes, on those Thursdays, so many times the whole of the UK came to a standstill, came out on their doors, banged on their pots and pans and applauded these nurses who want a 19% pay rise, who say that today they have provided emergency care. They're on this 12-hour strike, but actually planned operations have been disrupted, routine appointments, thousands of them have been postponed and will have to be rescheduled. And they say that they're striking not just because they need more money and they deserve more money because they've lost in real terms over the last few years in their pay packet, but also because they say that because of the vacancies, there are over 50,000 vacancies and short staff in England, about 150,000 UK-wide, it means that they're often understaffed and overworked, and therefore it endangers, they say, the life of patients. The government in no mood to compromise. Those talks between the Royal College of Nursing on Monday, between the Health Secretary and the RCN, failed completely, and the Minister was not at all prepared to talk about any pay rise. He was merely there to talk, he said, about conditions. And the government says it's simply not affordable. The Health Secretary reiterated it this afternoon. In the economic pressures that the United Kingdom is facing, a 19% pay rise is absolutely not affordable, and what they're still offering is 4 or 5% only. So clearly no resolution, and that next date, next Tuesday, for the second day of 12-hour strike, seems very much set to go ahead.
Benedict, back in 2019, when the Conservatives won a landslide, their then leader, Boris Johnson, was always in his stump speeches talking about the National Health Service. This was before COVID. At the time already, the Tories were getting out ahead of the issue. There was the question of how to pay for it was already front and center. What happened?
Well, what happened, and one thing you didn't mention that was very much the leader, Boris Johnson, during Brexit. Do you remember those signs on the side of red buses, François, where it said £300 million a week once Brexit was done and enacted, and that the UK were to vote in the 2016 referendum, then all that money would be poured into the NHS. So yes, a lot of money has been poured into the NHS, but it's simply not enough. Now, one of the big problems I alluded to in my first answer is the fact that there are so many vacancies. When you train these nurses, but because they're underpaid and the pandemic has taken a huge toll as well, and that burnout, why is the NHS, is one of the major questions, hemorrhaging, I think is the word I'm going to use, so much staff? Some of them are going to food banks in order to be able to continue to pay their bills and feed themselves. Others are actually working on top of their full-time job an extra day they call a bank day, I've found out today from being here, and that is a day when they work for an agency, and guess what? They're paid double their normal salary. And this is what doesn't work. That's not a good long-term strategy for the NHS. So clearly, the government wanting, as a matter of principle, to say to all of the public sector, because we have so many strikes, it's a winter of discontent that Rishi Sunak has inherited from his predecessors, Truss and Johnson. We've got Royal Postal strikes, we've got train strikes that have been going on since June, no proper train service until the 9th of January. We've got train instructors, we've got border force, we've got lecturers, we've got ambulance drivers. It's almost back to the 1970s. So they're clearly the government saying, no, you all need a 4 or 5% pay rise, no more than that, we can't afford it. And particularly the nurses, who are getting a lot of support in the polls, and I've witnessed it, as has my cameraman, all day long. So Roll on Tuesday is what the nurses say, because they are serious about picketing and about continuing this strike, but of course providing emergency care, they say, as and when obviously needed.
All right, plenty of tooting and